Dear friends, welcome to Medicine Medical Coding Academy. My name is Dr. Santosh Kumar Gupta, medical coding trainer, almost 20 years experience, and I have worked in US for 7 years. Today I'm going to explain you about the medical coding scope. I'm sure you all are experienced the medical coders more than 2 years or 3 years, and some people are more than 5 years. But now you are confused what to do further. What is the scope of medical coding? How to get a salary of more than 2 to 3 lakhs per month? How to get jobs in Singapore, Australia, and America. Don't worry, guys. I'm here for you. You know very well about me. We are the pioneers in the medical coding and ICU training. We trained more than 10,000 coders, and many medical coders of medicine. Dr. Gupta students are working in Ireland, Australia, USA, UAE, and also in the UK. So there is a secret. Yes, medical coding, how to use the knowledge you have, the experience you have to get a highly paid jobs. I'll explain you. Don't worry. So please subscribe to this channel, Medicine, and don't miss any single video further. This video, I'm going to explain you about the HL7, Health Level 7 for the medical coders. Next video, I'm going to explain you how to use medical coding in the blockchain. You know, Bitcoins? Yes, the same thing. Blockchain in medical coding. So don't miss any single video. Subscribe to this channel. Let's go to next slide. Medical coders has numerous career options. So all these days you work as a medical coder, auditor, a manager, right? But I know you have lot of creative skills, innovative skills. You have a passion to learn more. Yes, I'm here to help you. So medical coders, the next career option is HL7, Health Level 7, the big data, blockchain, that's for bitcoins, snowmed line codes, HIE, nothing but health information technology and health information exchange, SAP Medical, FHIM, Fellowship in Health Information Management. Let us discuss one by one detail, but today we are going to discuss only about the HL7. I tell to all my students every time, learn more, do more, be more. Don't stop learning. If you take my example, I have cleared more than 45 certification exams. I cleared HL7 exam in 2008 in Bangalore. And from that onwards, still I'm studying. Now today I'm still studying the UK coding. I'm studying Canada coding. I'm studying how to code the Australian medical records. So don't stop learning. Live as if you were to die tomorrow. Learn as if you were to live forever. Remember guys, education is very powerful weapon. The more you invest for education, you make money 10,000 times. You know very well. You spent a lot of money and time and hard work for the CPC exam. You cleared CPC exam. You're enjoying your job. Now, what next? That I'm going to explain. So HL7 for medical coders. HL7 means what? Health level 7. So health level 7 is a standard for the data interoperability. So once you get training in HL7, you can take the exam called Certified HL7 Specialist. This exam you can take pan-India through Criterion Centers online exam, multiple choice questions, just like our CPC exam. Easy to pass if you do some hard work and if you are smart. So even though when I say it's easy, yes, it depends upon the skill, just like medical coding. So this HL7, Health Level 7, FHI is called FIRE, is a standard that enables electronic healthcare data to be exchanged between the different healthcare systems. So HL7 is meant to exchange the data between the two systems, two entities, two organizations. So what we exchange? We exchange what? The patient demographic data. We exchange the medical codes, ICD code, CPT code, HCPCS code. See, for example, now when you submit a claim from the medical billing software to the insurance company, the exchange happens through HL7. Okay. When you submit the medical data from EMR to the pharmacy, the prescription goes in which format? HL7 format. When a physician orders a lab order, Then the lab order goes to the lab through HL7 format. If you take a typical clinic like Mayo Clinic in America, they say that they exchange 2 million messages every day between the lab, pharmacy, diet, multiple departments. So entire medical data exchange happens only through the HL7 format. So HL7 is a standard. It's a standard for the health care data exchange. So it's a global, throughout the worldwide, everyone has to exchange data only through the HL7 format. So now HL7 is not a programming. It's not a, it's only standard for the data exchange. Okay. Okay. For example, assume you are a medical coder. How you are getting data? You're getting data from the US companies, right? Like electronic medical record. How they transfer data to India? Yes, some people they transfer data to India through FTP. There's a crude way of transferring. But the proper way is what? HL7 data standards. So because you are medical coders, you know what to exchange, what not to exchange. You know, in HIPAA, we have something called minimum necessary. You have to exchange the data which is supposed to be exchanged. Okay. So for example, if you're submitting a claim to insurance company, you exchange what? Demographics and also the information about the medical codes. Am I right? Okay. Now, the physician ordering a lab report, the lab to the lab. Okay. So, physician has to send the lab order. Along with lab order, they have to send a pathology code, the code from the pathology CPT series, 80,000 series. You got the point here. So, the CPT code also has to be exchanged. Now, what happens here? Sometimes doctors don't know the coding. So, as HL7 specialist, you know very well the medical coding, you know how to assign the codes, you know HL7 programming. I mean to say standard. So automatically what happens here, you know how to submit the code properly to the insurance company. That's why we say that we require medical coders for the HL7. So why we require HL7? Yes, require for the quality care means until unless you transfer the information on time, you can't give quality care. You know, there should not be any communication gap. HL7 enables easy data sharing. There is consistency in the data and also it's a global standard. See, just imagine COVID-19 pandemic. In Germany, people they record in the German language. India they record in the English language, right? America English. So Mexico Spanish, right? Every country they use their own language. But what happens when they exchange data to the WHO? How to exchange? Only through the HL7. Suppose, for example, tomorrow the government wants data from a particular hospital. Now they can't give hard copies, they can't send the email, they can't fax. How they transfer data? Only through the HL7 standard. Guys, remember HL7 is not a programming, it's only a standard for the healthcare data exchange. So being a medical coding specialist, you are the right choice for the HL7 work. As you're expert in the ICD, CPT, HIPICS coding, you know how to transfer data, what to transfer. You know types of claims, you know types of code used, and you know who requires the codes and what codes has to be transmitted. Hence, we say that medical coders are best for the HL7. So here you can work as a data exchange specialist or you can work as a system architect. Yes, this is a very important slide. Please concentrate. You can see here HL7 example. Now you can see the example here DG1, diagnosis 1 segment. R50 is ICD code, fever of other and unknown origin. In the next line, you can see 163, 169320000, nausea and vomiting. Next line, you can see J14 pneumonia due to Haemophilus influenza. Yes, very good. Now you know very well. Yes, so what data has to be transferred? Now see here, the patient came with fever and nausea. The diagnosis was pneumonia. In this example, physician transferred R50 fever and also J14. But you know very well, as per the medical coding guidelines, we are not supposed to code what? Symptoms and signs whenever there is a final diagnosis. So in this message, you have to exchange only J14. Okay. Yes. Now you come into picture. Medical coders with medical coding knowledge, HL7 knowledge, what you will do? You won't submit the first line, that is R50. You submit only the second and third line in a HL7 format. So this is the standard for the data exchange. I think it's very clear now, right? Role of HL7 in medical coding. Okay. So the HL7 training we provide for 2 days only. It's a very small subject, 4 hours per day. But however, you have to do homework for 10 days. So overall 60 hours program, 2 days, 4 hours per day, and followed by the 10 days homework. So after the training, you can go for the HL7 specialist exam. Exam will cost you $300, one attempt and MCQ questions. Training fees is 20,000 INR. So what we provide here, we provide the certification training, study material, the question bank, 2 mock exams, and also international job placement assistance. Plus, we'll explain you how to implement medical coding system together in the telemedicine. Yes, there is a huge scope in telemedicine nowadays. So the basic qualification required is a certified coder. You should have a basic medical coding certification. You require a laptop for the training. You require passion to learn and plenty of time to practice. If you have these things, I'll help you to get certified. So guys, don't miss the opportunity. Excellent opportunity for medical coders. There's a time to get a rewarding career. Don't miss the opportunity. There's a huge demand for the HSM specialist with medical coding knowledge. The companies are Wipro, TCS. You can just browse doctor.com. You can see all MNCs, including IBM, Siemens. They want HSM specialist with medical coding knowledge. Okay, don't delay. So please visit Medesun.com or you can WhatsApp me at the number given here. But please don't call me. Visit personally or WhatsApp, and we are going to start a batch within 10 days. Yes, we work together and I'll help you everyone to clear the exam. Thank you very much.